Okay, I'll be performing my newborn assessment today. So I'm going to start by checking the vital signs of the baby. So I'm going to check its respirations first. So I should do this for a full minute, and it should range between 30 and 60 breaths per minute, which is present. And I'll go ahead and check its apical pulse for a full minute. I'll be doing this for, well, it should range between 110 to 160, which is present. And I want to be able to check the temperature. So I'll do this by doing the axillary, and the temperature should be within 97.7 to 99.5 Fahrenheit. And I'm going to want to assess the pain of the baby, so I'll use a flax scale. And after this, I'm going to want to weigh the baby, so I'm going to use a weight machine. Make sure there's a blanket underneath before I set the baby down for warmth. And the weight should range between 2,500 grams to 4,000 grams. And after I weigh the baby, I want to measure the baby. So I'm going to measure the length. So I'm going to use a measuring tape, and the length should range between 18 to 22 inches. Then I'm going to want to assess the skin of the baby. So I want to make sure the skin is consistent with its genetic background. I want to check the texture, which should be flexible and smooth. I want to check the turgor, which is elastic. And I want to check for wingo, which is when there's hair present on the baby and it's absent. And I want to check for rashes on the body, so there's no rashes present. And I want to check for Mongolian spots, which is absent. And I want to check the vernix, so which is present. Next, I'm going to go ahead and assess reflexes. So first, I'm going to have a pen light. I'm going to use this to check the blink and pupillary reflexes. And the pupillary should constrict, and it should blink with the light, which is present. And I want to check the moral reflex. I could do this by snapping my fingers or lifting the baby and slowly letting it fall and it gets scared. And I want to check the rooting. So the rootings, you stimulate the side of the cheek and the head turns in your direction, which is present. And I want to check the sucking, and I want to make sure I have gloves before I do this. And I stick my finger in there, and the sucking is present. While I'm in there, I'm going to go ahead and check the soft and hard palate, which are both intact and present. And after I check this, I want to go ahead and check the palmar grasp. So you do this by sticking your fingers in the infant's hands, and it's supposed to squeeze, which is present. And then I want to stick the fingers in the soles of his feet, and it's present. The toes are supposed to go over the, kind of like grab your fingers, which is present. And then I want to be able to lift the baby and do the stepping, check if it's stepping, which is present. Then I want to check the Babinski sign, which you stimulate the side of the foot like an upside down J, which is present. Then I want to do a tonic neck fencer, so I'm going to turn the baby's head in my direction, and its arm's supposed to extend the same direction as his head turned, which is present. And I want to be able to check the prone crawl. The baby's supposed to try to crawl, which is present. And while I'm doing this, I'm going to check the trunk incurvation. So I'm going to do this by stimulating the spine on the side. And as I stimulate it, the baby's pelvis is supposed to flex in that direction. And then I'm going to go ahead and assess the head. So I want to check its appearance. So it's symmetric, moves easy, and it's round. Then I'm going to use the measuring tape to check the circumference. So the circumference should be between 32, 37 centimeters. And I want to go ahead and check for molding, which is usually present, and it is present. And while I do this, I want to check the fontanelles. There's the interior fontanelle, which is diamond shaped, and then there's a posterior fontanelle, and it's triangular shaped, and they're both palpable. And I want to go ahead and check for cephematoma, which is absent, and the caput, which is present. Then I want to go ahead and assess the face of the baby. So I'm going to check its appearance. It's symmetrical and it makes grimaces. Then I want to check for forceps or vacuum marks, which are absent. And I want to check the melia, which is little spots on the baby's face, a little white, which are present. They're normal. And I'm going to go ahead and assess the mouth. First thing I'm going to check is the facial hypoglossal nerve, the glossopharyngeal, and vagus nerve, which are all present and intact. And I already checked the palate and the soft palate, which are intact whenever I had my finger in its mouth earlier with the glove on. And I want to also check the tongue, make sure it's midlined and it's freely movable, which is present. And I'm going to go ahead and assess the ears, and the ears are supposed to be parallel with the eyes, which is intact and present. And then I want to go ahead and assess the hearing, which is intact. Then I want to go ahead and assess the eyes now. The appearance is clear, bright, and even, and the coordination is intact. I want to move my finger around to see if, yeah. And the color of the eyes are brown. Eyelids are no drooping. Movement is intact, and the inspection seems edematous, which is normal, and the cornea is clear. The sclera is bluish, which is normal. Pupils react to light. I already did this whenever I had my pen light with me. They react to light equal and round. The conjunctiva, which is pink, which is good. The vision is fixed and focused on objects. The lashes are present. The lacrimal glands are tearless cries, which is normal. Okay, then I want to assess the nose, which is midlined, and I want to check if the nares are patterned. So I want to put a finger on each side. Make sure you hear that air. Then I want to check the neck now, which is straight and short, which is normal. I want to check the clavicles, make sure they're straight, intact, and symmetrical to shoulders. So the clavicles are good. The chest circumference, I'm going to use this by using a measuring tape. So I check the circumference, which should range between 32 centimeters. There's bilateral expansion and no retraction, which is good. Then I want to be able to auscultate and hear the breath sound since I'm in the chest region. So I'll go ahead and do that in the front. Then I want to do that in the back of the baby, which is clear breath sounds bilaterally. And if the infant was a female, I would go ahead and check the breasts, which should be flat and the nipples are symmetrical. And I want to check the heart. So I'm going to go ahead and do the 5 regions of the heart, just like an adult. So There's murmurs with no thrills, which is normal. Now I'm going to assess the abdomen. So first I'm going to measure the circumference in centimeters. The appearance is no cyanosis. I will now auscultate the bowel sounds. Which is 10 to 30 seconds, which is normal. I want to check the umbilicus, make sure there's no protrusion. There are 2 arteries, 1 vein present, no bleeding. I want to check the femur pulses, so I want to be able to feel that. So yes, they're palpable, equal, and bilateral. So now I want to check the inguinal area. I want to make sure there's no knobes or bumps. And now I'm going to check the extremities and trunk. So general, it's short, the trunk, well, the arms and legs are short, flex, movable joints, which is good. Arms, equal, flex, bilateral movement. Hands have 5 fingers on both with fingernails present. Okay, now, the spine, it's supposed to be C-shaped up, and then when it's flat, it's supposed to be straight. And I want to check the hips, make sure there's no signs of intangibility. I'll be using the ortholantis maneuver. So I'm going to go ahead and lift the legs up forward towards the chest, and then I'm going to go ahead and move both legs to the side to hear if there's a clicking sound. Make sure there's no dislocation. I want to make sure it's symmetrical. There's symmetrical inguinal and buttocks creases, which is present. Then I want to make sure the legs are equal in length, which they are, and the feet have normal toes, 5 toes on each foot with toenails. I want to also check for jaundice of the skin. So this baby doesn't have it, it's absent. It usually occurs 3 days after birth. And when I check the bowel movements, I'm gonna see if there's meconium. So there's no meconium right now. It usually happens within 8 to 24 hours after birth. And I want to also check the urine, which is supposed to be clear, pale, and yellow. And it occurs within the first 24 hours. I want to go ahead and check the genitals now. So if this baby was a male, I want to make sure the penis has the foreskin over the gland. I want to make sure to see the erectile tissues intact and present. I want to make sure the scrotum has normal color, skin is loose, hanging, and small, which is present. And I want to go ahead and check the testes, make sure they're descended. And if it's a female, I want to check the mons, which is supposed to be normal skin color. The labia minora covers the labia minora, and labia minora covers the labia. Labia majora covers the labia minora. And I want to check the clitoris, which should be large, which is present. I want to check the vagina. The hole is visible. Bloody mucus discharge, which is normal. The buttocks and anus are symmetrical with no tears and it's patent. And the baby's cry is strong and lusty. And that's my newborn assessment.